Hello everyone, good morning. And so my name is Kevin Chen. So I'm CEO of eDoc Acquisition Corporation and also Adjunct Associate Professor at NYU, Chief Economist at Horizon Financial. So I'm very honored to come to share about our healthcare investment experience and our outlook going forward. So about myself, very quickly, I have a PhD from University of Lausanne in Switzerland. Also got a master's degree from Tilburg University in Netherlands and a BA from Renmin University of China. So, and I've been living in America for the last 20 years, first in Chicago and now in New York. So, and also I'm a member of the Economic Club of New York, Bretton Woods Committee, and Foreign Policy Association and some other boards. So currently we have a registered investment company based in New York, and also we have a spec company. And previously I worked at Morgan Stanley, at China Development Bank, at Amundi, etc. And also I'm teaching as an adjunct professor at NYU for the last 8 years now. So let me give you some, very quick update of what we are seeing for the healthcare industry, and based on our, I would say, investment experience, but also the recent update in the healthcare industry. So I guess I saw one of the previous speakers talked about the telehealth, telemedicine. Clearly, it's a major trend, and it's a combination of not only about telemedicine but also remote consultation. So Teladoc is, you're all aware, it's one of the major public traded companies now. The headquarters actually is in New York, not far from my home, like 10 minutes away, and in Purchase, and they're growing very fast. But it's an industry phenomenon, not only just one company. Recently, we were at some industry conference. The Presbyterian Hospital of New York, related to Columbia University, they talked about 30 times increase of remote appointments this year since COVID-19. So the growth of telemedicine is exponential, and I don't think it's going back, because a lot of it's for the protection of the doctors, but also for the protection of patients and for the for the other healthcare professionals. And so that's a major trend, and that's what we are working on as well, to help the penetration of telemedicine. This is, of course, in the US, it's growing very fast, but also in other countries. In China, since COVID-19 outbreak, it's the first time the government allows telemedicine to be reimbursed in the Chinese, what's called Medicare reimbursement system. And before that, it was not allowed, only physical visit, but now they're allowing it, which is a major push toward telemedicine going forward. So that's the first major trend we're seeing. The second major trend is about decentralized healthcare. And I know a lot of the entrepreneurs in this conference, I think you guys are based in the West Coast, in Silicon Valley. And I know probably a lot of you are involved with cryptocurrency, about decentralized finance, and about the crypto revolution. What I can share is healthcare industry, exact same thing, decentralized trend. And we have been investing in a lot of hospitals, medical centers, etc. The major medical centers are consolidating. In the past, usually in the US, every county has a major medical center, with like those like helicopter pad on top, with all kinds of specialties, and we're seeing consolidation. Going forward, a lot of the counties, they're going to, probably 2-3 counties are going to share one medical center. Those comprehensive medical, very expensive medical centers, they are consolidating. It's not going to be every county has one. And of course, the major medical centers like Mayo Clinic, like Cleveland Clinic, Mass General, etc. Those medical centers, they are still going to be doing very, very well. However, I would say a lot of mid-level medical centers, they will be consolidated. They will not be able to continue as independent entities. However, the major growth we're seeing is actually the specialty clinics. That was actually before COVID-19 outbreak. Last year, we were seeing, for example, dermatologies, veil clinics, and a lot of those. In fact, the patients and the physicians, they all prefer to have specialty clinics, and even surgical centers is a major growth point right now. We're building a lot of new surgical centers that are affiliated with hospitals, but physically located separately or in a distance from those medical centers. It's really it was a trend, and before COVID, but COVID-19 accelerated this trend. Now, the patients, they actually also prefer to have their procedures done at a surgical center that's not part of a major medical center. Of course, the reason is to avoid cross-infection at those hospitals. And you are all aware that since the COVID outbreak, the infection problem at those hospitals are a major challenge. So one solution to this is to have decentralized healthcare going forward. And I think this is something it's happening in the US since a couple of years ago. It's accelerating now post COVID-19, and it's happening in other countries as well. We're seeing this same trend in other countries, decentralized healthcare. Third one, wearables, a major trend. And we're going to see basically 24/7 health monitoring. The reason is wearables are being developed very quickly. Recently, Apple started shipping the iWatch version 6. Version 6 can check your blood oxygen level. And so one of a very important vital signal is your blood oxygen level. And in particular for the COVID-19 patients, it's very important to make sure your blood oxygen level stays below an X percentage, something like 95%. So how to do this? Now, iWatch can do this for you. And not only this, but Fitbit and many other wearables are being developed, and people are going to use a lot more of those wearables. And also those, for example, sudden fall function of iWatch. It has saved thousands of lives in America. A lot of people, seniors, could be also young people. They live alone, and if they have a fall in their residence, and the sudden fall function would send alarm to the healthcare providers, and if it's triggered, the healthcare professionals would contact the person, and would save lives. And that's very important going forward, to have this 24/7 coverage. And that's another major trend. And I think innovations are coming in this field too, because a lot of those smart, Internet of Things, IoTs, they're going to expand aggressively into healthcare. Fourth one, the what's called chronic disease management. Livongo is one of the top ones, but there are a couple of others. And Livongo is from, I think they are, it's a very successful company based in Mountain View, California, next to Google campus. And they are very good at managing, chronic disease. And but all the top 5 disease for human being, I saw statistics something like 90 to 95% of human beings are going to get one of the three or more of those top five disease. And all these diseases, they are going to be some kind of long-term management issue instead of some, let's say a short-term cure. For example, it includes the top five. It was actually discussed at Harvard Family Office Summit last year. Cancer, diabetes, Alzheimer's, obese, and cardiovascular problem. And how to, in fact, if you look at the survival rate for cancer, 5-year survival rate for prostate cancer, it's almost 100% in the U.S. now. It was unthinkable even a decade ago. So the survival rate already doubled, and diabetes and many others. And how to achieve this is really done through medical breakthrough, but also it's done through a better management. Human beings need to basically learn about live with those chronic disease. These diseases are not going to be a killer like in the past, and we need basically have a good long-term management solution. And I believe innovations are being done in this field, and more is coming for the chronic disease management. Again, it's in the US, but we see the same being done in other countries. And this is actually really saving lives, including the improve the quality of life and the survival rate. The fifth major trend is about the healthcare and insurance. They are trying to take over each other. A couple of examples in East Coast, we saw a very good company called Oscar Health, a technology-based healthcare insurance. The customers can use app to communicate with doctors with geolocation data. So the app would identify the doctors around you and help you to connect with the doctors. And doctors can monitor the customer's medical history, and also they track your lifestyle to provide discount for your healthcare insurance. And also they use data analysis and to use preventative care to improve healthcare. And also it will cut the expense, the cost for the healthcare insurance providers. So this is a win-win. So they can try to get almost zero or close to zero premium and have a cap on the cost. And they are doing tests on a lot of counties, states in Arizona, Georgia, New Jersey, Pennsylvania, South Carolina, Tennessee, Texas, etc. And this is a firm also, Clover Insurance. It's founded by Sequoia Capital. You have Google Ventures, etc. involved. And I believe this is also a major development. And of course, that's one side. The insurance, healthcare insurance companies are expanding into the healthcare industry. But also the healthcare industry, many of them, they are in fact expanding into insurance to basically build a captive insurance provider. And that would essentially reduce cost as well. For the biggest part for insurance really is about cost, because premium is very much regulated. So if you can cut down your cost, you'll be a winner. So that's the fifth trend in healthcare. So those are my prepared remarks, and I'm happy to do some Q&A with other panelists. Thank you.